So the question is, or the comment really is, those are classic methane SIBO symptoms. And this was in response to a patient that I recently treated who had constipation and bloating. To which I say, SIBO is a theory. It's a theoretical hypothesis. It has not been proven, and the test has not been proven. So 100 years ago, we knew there was something called small intestinal bacterial overgrowth, and it happened for people who had motility issues, scleroderma, which is an autoimmune disease, and gut resection, where part of the small intestine was removed. Motility wasn't happening. So this whole SIBO is a theory that came up about 20 years ago when someone said, oh, maybe IBS and SIBO are the same thing. And so now we've had 20 years of basically testing on our patients to see if this is true. And so far, I'm waiting to hear from someone to tell me they've got permanent results from treating a methane dominant SIBO with, so methane dominant constipation SIBO with rifaximin or neomycin or metronidazole, because you don't treat constipation with antibiotics. It's unheard of, except for in the SIBO crowd where it's heard of but not proven. So there's in-house testing, there's testing that's been sponsored by people who have a horse in the game, but there's no independent testing. The only ones that I've seen that are outside of Cedars-Sinai independent testing are the ones that have tagged the lactulose. And these are gastroenterologists in Canada, US, and the UK. They tag the lactulose and it goes through the small intestine really quickly. The gases don't rise until it hits the large intestine, after it hits the large intestine, which is normal. We normally produce methane, hydrogen, and even some hydrogen sulfide and carbon dioxide in the large intestine. It's a fermentation system. That's what it's supposed to do. So let's put on our thinking hats and make sure that we are treating an actual pathology rather than normal physiology when it comes to